Common in teenagers. Why? Because teenagers, they are in crisis. Okay. Common in elderly, because elderly as well as chronically ill patient, they thought that they don't have any function in the society or in the community. Grieving. The grieving process usually lasts for 2 years. 2 years, not 3 months. 2 years. Okay? 2 years, the grieving process before they are able to move forward. So that's the grieving process. Bipolar, a manic depressive disorder, sudden shifts of emotional extreme from depression to mania. So sometimes there are some people who will be asking you, come here, sit down beside me, right? After you sat down beside her or him, few minutes after, they're saying something against you, right? But they are the one who asked you to sit down beside them. So manic depressive disorder or vice versa. If they have manic manifestation, you need to use a medication known as lithium. Lithium. For manic, use lithium because lithium is anti-manic. There are so many bipolar disorders or manic disorders, abnormal overactivity and euphoric state, euphoria or being elated. I'm going to focus, of course, on your SAD or SAD. And of course, we talk about postpartum depression. The SAD, seasonal affective disorder, winter depression. The weather affects their mood. The weather affects their mood. Sometimes it's geographical. For example, if you are in Alaska, if you are in Seattle, so the weather is kind of gloomy, so more at risk to depression. Postpartum depression, we talked about this already yesterday. Medical treatment. Group therapy, antidepressant, anti-manic. What is the anti-manic that we talk about? Lithium. And of course, we have ECT. ECT, do you need to shampoo the hair? No. That's EEG. Okay? Do not shampoo the hair. That's EEG. For shampooing the hair. So, the first thing that we need to have, if we have psych concern, depression, anxiety, the first thing is group therapy. All right? What we have right now, if you share your experience with someone, that is group therapy already. Informal group therapy. The formal group therapy, of course, there must be a moderator. Like, for example, if someone is saying, I don't think my neighborhood likes me. The moderator will be asking, what do you mean by that? And then someone will be saying, oh, I have the same feeling, but you know what I did? But that's group therapy. Like what you are doing here. Okay, that's group therapy. Okay, you share your experience and someone is giving feedback. That's group therapy. All right? Antidepressants, of course, when you say antidepressant, antidepressed, so you will become stimulated. So keep this in mind. If this is antidepressant, the side effect is being stimulated. It's antidepressant. So if I'm taking antidepressant, do I need to drink coffee? No, because the more that I will be stimulated. If I'm taking antidepressant, one of the side effects is insomnia. I am depressed. I took antidepressant. I'm okay. The side effect is insomnia. I can't sleep. So stimulation or being stimulated is a side effect. So anti-manic, we will be talking about that, and of course ECT as well. We have different types of antidepressant medication. We have MAOI, the MAOI, the TCAs, we talk about this, STEPS or PETs. We have the SSRI. Now, all of these antidepressants are considered as a stimulant. All of these are considered as a stimulant. But of course, they are very particular with the ingredients or with the components of our MAOI or the MAUI, that we should not give anything with tyramine, because tyramine is a stimulant. So you give tyramine to the patient who's taking MAOI, the more that there will be stimulation and hypertensive crisis will occur. For sure, you're already familiar with tyramine. Tyramine can be found in bananas. Tyramine can be found in bananas. That's why they said, if you feel sad, eat banana. Eat banana if you feel sad. When is the best time to eat banana? Right? So in the morning, so that at night time you will become insomnia. So watch out, of course, for the side effects, and watch out, of course, for the diet. So in monoamine oxidase inhibitors, you have your marplan, nardilparnate, and of course a lot more. Avoid tyramine, because there will be a possibility of hypertensive crisis. Do not take anything with over-the-counter decongestant, because it has tyramine, epinephrine, that will increase, of course, your blood pressure. Anything that is aged, smoked, and fermented, they have tyramine. Anti-manic agents. Anti-manic, of course, lithium. What are the things to remember for lithium? Avoid diuretics. Avoid diuretics. Diuretics increase excretion of lithium. And the diet should be moderate sodium diet. Moderate sodium diet. ECT, electroconvulsive therapy. In the Philippines, if they perform ECT, all right, they just have what? Roll towel. They put the roll towel in the patient's mouth. Bite. Here in United States, they are under general anesthesia. Okay? Now, what's the main reason why they need to perform ECT? Electroconvulsive therapy for severe depression, mania, and psychosis. They are correcting the impulses as well as, of course, the movement of the brain. They will have this temporary memory loss for 2 months. So they will forget that they have depression. And during that 2 months, they're going to have this training, they're going to have assistance. So that when they remember everything, they are good to go. Because without assistance, all right, when they remember everything, they will feel depressed again. All right? So when are they going to use electroconvulsive therapy? If the medications, the group therapy medications and other managements are not effective anymore. So the last resort when it comes to management is the ECT. That's the last one. All right? Do you need consent? Yes. Do you need to ask the patient to sign the consent? No. They are not in their correct mind. Remember, they have severe depression, mania, and of course, psychosis. So after ECT, monitor vital signs, patent airway, because they have drooling, position, of course, sideline position, reorient the patient, and relieve headache or nausea. I'm going to cut the discussions here in different disorders, but when we come back, we're going to continue this mental health discussions. For now, we can have our lunch. Because I've noticed that Nick is already trying to captivate me.